cerebellum in Latin it means little brain. It is the dorsal and largest part of the hindbrain and rhombencephalon. Its weight is about 150 gram. Location and relation. It lies in the posterior cranial fossa below the tentorium cerebellum. এটার সুইচ কোথায় রে? ওইখানেই আছে? Okay, so it lies behind the দরজাটা বন্ধ করে দিবি তো? ঠিক আছে চলে। Okay, so cerebellum lies in the posterior cranial fossa below the tentorium cerebelli, which is a fold of dura mater, and it lies behind the pons and medulla, and the fourth ventricle separates the cerebellum from the pons and upper part of medulla. It is separated from the cerebrum by the tentorium cerebelli. What are the functions? Cerebellum cannot initiate the motor activity, but it modifies the motor activities and makes them smooth, fine and more efficient. Cerebellum performs three primary functions: maintenance of posture, maintenance of muscle tone, and fine coordination of movements. Functions are very frequently asked in your viva. Okay. Next is cavity. The fourth ventricle separates the cerebellum from the pons and the upper part of the medulla oblongata. There are three cerebellar peduncles. Cerebellum is connected with the brainstem by three pairs of large white fibers called cerebellar peduncles, and they are: the superior cerebellar peduncle connects with midbrain, middle cerebellar peduncle connects with pons, inferior cerebellar peduncle connects with medulla oblongata. See here, this is cerebellum. In front of it lies this fourth ventricle. This dent-shaped structure is the fourth ventricle, and in front of it lies the brainstem. Three parts of the brainstem: midbrain, pons, and medulla oblongata. Okay. And here you can see cut sections of the vermis. Different parts are there. We will discuss in details. In midline, the vermis connects the two cerebellar hemispheres. Okay. So cerebellum is part of rhombencephalon, 150 gram in weight. Location lies in the posterior cranial fossa below the tentorium cerebelli, behind pons and medulla and fourth ventricle. Okay. Function is extrapyramidal activities, maintenance of posture, muscle tone, and coordination of fine movements. And cerebellar peduncles are three in number. Superior one connects with midbrain, middle connects with pons, inferior connects with medulla. Next is external features of cerebellum. This is very frequently asked in your viva table. Okay, cerebellum, external features. So cerebellum is oval shaped and flattened from above downward. Okay. Its transverse diameter is larger than the anterior-posterior diameter, and the surface of the cerebellum shows numerous fissures. Okay, very fine fissures are there. Next, what is the identification features? Cerebellum has three parts: two cerebellar hemispheres and one vermis. There are two surfaces, superior and inferior surface, two notches, anterior and posterior notch, and three prominent fissures: horizontal fissure, posterolateral fissure, and fissura prima. Okay. See, this is schematic diagram of cerebellum. This middle portion is the cerebellar vermis. On the two sides, these are the two cerebellar hemispheres. Okay. And see this one. This is fissura prima. This one is horizontal fissure, and this is posterolateral fissure. These are the three important fissures of the cerebellum. And this is nodule and this is floccule, and they are together forming flocculonodular lobe. Okay, flocculonodular lobe is separated from rest of the cerebellum via this posterolateral fissure. And see here, this horizontal fissure separates the superior surface from the inferior surface. Okay, and this fissura prima separates the anterior lobe from the posterior lobe. Okay, so three lobes are there: anterior to fissura prima, anterior lobe; from fissura prima to posterior lateral fissure, this is posterior or middle lobe, and here is flocculonodular lobe. So these are the three lobes, these are three fissures, and two surfaces: superior surface, inferior surface. Okay, understood? So these are the presenting parts of the cerebellum. So parts are two cerebellar hemispheres, median, vermis. Surfaces are superior surface, which is convex; inferior surface, you can see vallecula, which is deep notch. Sulcus vallecula separates the vermis from cerebellar hemispheres. Next, there are notches. Anterior notch is V-shaped, lodges the pons and medulla. Posterior notch is deep, lodges the falx cerebelli. Fissure. Three fissures are there: horizontal fissure, posterolateral fissure, fissura prima, and folia, leaf-like lamella separates set by the fissures. These are known as folia. And three lobes are there: anterior lobe, posterior lobe, flocculonodular lobes. Okay. So we will discuss these parts in details. First, we will discuss the lobes. Okay. So two cerebellar hemispheres, two lateral portions, and vermis is narrow median portion that connects two cerebellar hemispheres. So first, we will discuss the surfaces. Superior surface is convex, and superior vermis, that is, superior vermis means superior surface of the vermis. Superior part of vermis, it is continuous with the superior surface of cerebellar hemispheres. Inferior surface has a deep groove or notch in the median plane, and which is called vallecula. Next is vallecula cerebelli. Vallecula cerebelli means groove in Latin, and it is a deep notch on the inferior surface of that separates the cerebellar hemispheres. Okay. Next, there is sulcus vallecula. It is a sulcus that separates the inferior vermis from inferior surface of cerebellar hemispheres, and it is the lateral limit of vallecula. Next, there are notches. Anterior cerebellar notch is wide, shallow, V-shaped notch on the anterior part of cerebellum, lodges the pons and medulla. And posterior cerebellar notch, it is deep and narrow, lodges the falx cerebelli, which is fold of dura mater. Okay. Next, we go to fissures. There are numerous transversely running furrows of varying depth on the cerebellar surface. Folia. These are narrow leaf-like lamella separated by fissures, and each folium consists of core of white matter covered by grey matter. Three fissures are prominent and consistent, and they are horizontal fissure, which separates the superior inferior surface of cerebellum; posterolateral fissure, which lies on the inferior surface of cerebellum and separates the flocculonodular lobe from the rest of the cerebellum, corpus cerebelli. And primary fissure or fissura prima, it is V-shaped fissure on the superior surface with its apex is directed posteriorly. The cerebellum is divided into two parts by posterolateral fissure into flocculonodular lobe and corpus cerebelli. Corpus means body, main body of the cerebellum, and the flocculonodular lobe. Okay. Corpus cerebelli is divided into anterior and posterior lobes by the fissura prima. Cerebellum, so this is the sequence from above downward. First you will get the anterior lobe, then fissura prima, then posterior lobe, then posterolateral fissure, flocculonodular lobe. What is tonsil? This is asked in your viva. Tonsil is part of cerebellum on its inferior surface. In raised intracranial pressure, these tonsils may protrude into the foramen magnum. That's why it is important. Okay, cerebellar tonsils as the first part to protrude through the foramen magnum. See, these parts are the tonsils, and they are lying in the inferior surface, and they protrude through the foramen magnum in case of increased intracranial pressure. Next you see different parts of the vermis and the corresponding part of the cerebellar hemispheres, and they are different names. Okay, so first one is the part of the vermis we will discuss first. First is lingula, then central lobule, then culmen, declive, folium, tuber, pyramid, uvula, and nodule. Okay, all these are parts of the vermis. And lingula, there is no corresponding part. Central lobule, there is ala. Then the culmen, near the culmen, there is quadrangular lobule. Then near the declive, here is simplex lobule or lobule simplex. Okay. Next is folium. Near the folium, there is superior semilunar lobule, and below the horizontal fissure will be the inferior semilunar lobule, just near the tuber. Next is pyramid. Near the pyramid, biventral lobule. Then near the uvula, there are tonsils, and near the nodule, there is flocculus. Okay, so these are the different parts of the vermis, and these are the corresponding part in in continuation with the part of the vermis of the these are parts of cerebellar hemispheres. See here, this is the superior view of the cerebellum. See, anteriorly there is V-shaped notch, posteriorly there is a deep posterior cerebellar notch. And you can see the mid portion is the vermis, and on the two sides, two cerebellar hemispheres, and they are continuous. No much separating point, just little depressions are there. Okay, and this is fissura prima. Fissura prima separates the anterior lobe from the posterior lobe, and this is horizontal fissure. Horizontal fissure separates the superior surface from the inferior surface, and the flocculonodular lobe is lying near the in the inferior surface. Okay, this is inferior view. Here you can see the flocculonodular lobe. Here is the nodule, and these are the flocculus. So they are together forming the flocculonodular lobe. And this will be the posterior lateral fissure. And here you can see the vermis is very much prominent in the midline. Okay. And this projecting part is the cerebellar tonsil, and this is the vallecula. Okay, this is separating the vermis from the cerebellar hemispheres. And the peduncles of the cerebellum can also be seen in the inferior surface. Superior, middle, and inferior cerebellar peduncle connected to the midbrain pons and medulla. Okay. And this is cavity of the fourth ventricle, which is lying posterior to the cerebellum, anterior to the cerebellum. Okay, anterior to the cerebellum and posterior to the brainstem. So there are several fissures that divide the cerebellum into a number of divisions, and practical differentiation of these subdivisions on gross specimen is sometimes difficult. Okay, so very fine divisions. Hence, it is suggested to identify at least anterior, posterior, and flocculonodular lobes. These three you have to identify, and cerebellar hemispheres and vermis, and all those parts, different parts of vermis that cannot be seen separately in the viscera. You will be asked in your viva. Okay, also important for your theory. Next is bald simplex lobule. Lobule simplex. It is also called posterior quadrangular lobule. Another name is there. So this is the divisions of vermis and divisions of each cerebellar hemisphere. Its corresponding part. In the anterior lobe, lingula has no corresponding part. Then central lobule, ala, culmen is quadrangular lobule. Next, in the posterior lobe, declive, near it lies the simplex lobule, then folium, superior semilunar lobule, tuber, inferior semilunar lobule, pyramid, biventral lobule, uvula, tonsil, and flocculonodular lobe, nodule, corresponds to is the flocculus. Okay, so you can remember from this mnemonic, lazy cat die for taka pizza unnecessarily. Okay, L is lingula, C is culmen, central lobule and culmen, D is declive, folium is for, Takapisa is T is T-word, P is pyramid, unnecessarily N is uvula and necessarily nodule. And remember like this, okay? Okay, so next we go to the anatomical divisions or lobes of the cerebellum. It is divided into three lobes by two fissures. So anterior lobe lies on the superior surface, anterior to fissura prima. Posterior or middle lobe lies partly on the superior surface, partly on the inferior surface. And it lies behind the fissura prima on the superior surface and extends from the posterolateral fissure to the horizontal fissure on the inferior surface of the cerebellum. Next we go to flocculonodular lobe. It is a small lobe that lies on the inferior side of cerebellum anterior to the posterolateral fissure. Okay. Next, phylogenetic subdivisions of cerebellum. Cerebellum important for your theory. Okay, theory question comes. Internal structures of cerebellum. Histology of cerebellum is covered? Not covered. Histology is very important question for theory cerebellum, and also this phylogenetic division, lobes of the cerebellum. All this comes, and internal structure, internal circuit. Okay. So this phylogenetic subdivision based on the function and phylogenetic or evolutionary aspects, cerebellum is divided into these three parts. Archicerebellum or vestibulocerebellum. It is the oldest part of the cerebellum. Here we have color coding. We have done color coding. So this pink one represents archicerebellum. Pink and this archicerebellum includes this lingula and this flocculonodular lobe. Okay, and the paleocerebellum, it has been colored blue. It includes the anterior lobe except the lingula and this pyramid and uvula. Okay, and this rest of the portions are included in the neocerebellum, which is colored light yellow. Okay, so based on the function and phylogenetic evolutionary aspect, cerebellum is divided into these three parts. Archicerebellum or vestibulocerebellum, it is the oldest part of cerebellum, consists of flocculonodular lobe and lingula. Function is maintenance of body equilibrium, tone and posture of the trunk muscles. Paleocerebellum or spinocerebellum develops after the archicerebellum, consists of anterior lobe except lingula, uvula and pyramid of the vermis. What is the function? It receives impulses through the spinocerebellar tracts and maintain the tone, posture and crude movements of the limbs. Next is neocerebellum or cerebral cerebellum. This is phylogenetically, it develops last and most recent part. It consists of posterior lobe except the pyramid and uvula. Okay, all the posterior lobe except pyramid and uvula. Function, it coordinates smooth performance of skilled voluntary movements. Okay. Next we are going to internal features of cerebellum. Cerebellum is highly folded to accommodate millions of neurons in a small area, and these foldings are called arborvitae. Okay. Cerebellum is having outer grey matter, that is cerebellar cortex, inner white matter is cerebellar medulla. Cerebellar nuclei, these are grey matter embedded deep in the medulla. Cerebellar cortex is uniform throughout, and cerebellar cortex shows three layers: outer molecular layer, middle Purkinje cell layer and inner granular layer. Okay, this structure is important. Molecular layer, it lies just deep to the pia mater, that is outermost, and it is a lightly stained layer with He stain, hematoxylin eosin stain, and it consists of few cells and more fibers. Cells, what are the cells lying in molecular layer? It has stellate cells in superficial part and a few basket cells in the deeper part. And fibers are molecular layers, so numerous branching processes of the Purkinje cells, tree-like branching occurs of the dendrites of the Purkinje cells, and actions of the granule cells and climbing fibers are lying here. Archicerebellum is the oldest part and it was the only part of cerebellum in fishes and lower amphibians. Here you only get archicerebellum. Paleocerebellum is seen with archicerebellum in reptiles and birds, and neocerebellum is prominent in higher mammals. Next, so we have discussed the molecular layer. Next, we go into the Purkinje cell layer. Purkinje cell layer consists of a single row of Purkinje cell bodies. These are very prominent. You can see the prominent cell bodies, okay, in the histology slides. So Purkinje cell layer is consists of a single row of Purkinje cell bodies that are arranged between the molecular and granular layer. Purkinje cells are large flash-shaped neurons. Dendrites of Purkinje cells arise from the apex of the flax and enter into the molecular layer. Single axon arises from their base and that passes through the granular layer and white matter to the cerebellar nuclei. Okay. Next we go to the granular layer. It lies between Purkinje cell layer and white matter and it stains dark with hematoxylin because of closely packed numerous small granule cells, and cells lying in this layer are granular layer has granule cells, Golgi cells. Granule cells are small neurons with rounded nuclei and Golgi cells are large stellate cells. Okay. What are the fibers in the granular layer? Granule cells has mossy fibers that bring the information from pons to the granule cells, pontocerebellar fibers. And climbing fibers and axons of Purkinje cells pass through the granular layer. So these are the fibers in this layer. And glomeruli, cerebellar glomeruli. Glomeruli you have get in kidney. Okay, so here also glomeruli formation occurred. Okay, here blood vessel does not form glomeruli, nerve cell bodies, and they are different processes together forming the glomeruli. Okay. This is asked in your viva how the glomeruli is formed. Okay. So glomeruli, mossy fibers end as dilated terminals, and this dilated terminal is surrounded by dendrites of the granule cells and axons of the Golgi cells. Mossy fiber terminal with surrounding dendrites and axons form light stained area in granular layer, and these areas are called glomeruli of the cerebellum. Okay. And white matter of cerebellum is composed of fibers and neuroglial cells. Neuroglial are supporting cells. See here, this is the histological picture of cerebellum. Okay, like this you will see under the microscope. So this is the outermost portion covered by the pia mater. This is pia mater. Okay, so it consists of three layers. This is first layer. This is molecular layer. Okay, this is lightly stained, light pink staining. Then these dots you can see, these are the single cell layer. This is Purkinje layer. Okay, this deep pink dots you can see. So these are the cell bodies of the Purkinje cells, and their dendrites are forming branching in this granular layer. Okay, axons are passing through this granular layer, and this inner pink portion, this is the white matter of the cerebellum, and this violet portion here you can see multiple violet dots. These are the cell bodies of the granule cells. This is granular layer. Okay, so this deep staining area is the granular layer, outer pink staining is the molecular layer, in between single cell layer is the Purkinje cell layer. So these three layers together forming the cortex of the cerebellum, and this inner pink portion contains the white fibers, white matter and the neuroglial cells, and this is forming the white matter. Okay, and this is enlarged view. You can see this is the molecular layer, this is Purkinje cell layer, and this is the granular layer, granule cell layer. Okay, or granular layer. In granular layer, multiple violet dots you can see. That is the difference. Okay, see this is schematic presentation. See this part is the white matter from outside inward, molecular layer, Purkinje cell layer, granular layer. Okay, Purkinje cell bodies you can see, actions are passing through the granular layer and entering into the white matter. And this is molecular layer. It is contains the dendrites. Dendrites are forming tree-like branching within the molecular layer. And here another cells are these stellate cells, and these are the basket cells. Stellate cell, basket cells, this Purkinje cell dendrites, and these are yellow fiber, climbing fibers are anastomosing with them. Okay, and here in the Purkinje cell layer only Purkinje cells you are getting, and in the granule cell layer you can see this is one glomeruli formation. Okay, here you can see this is granule cell and this is Golgi cell and climbing fibers. All these are anastomosing with each other. Together they are forming the cerebellar glomeruli. Okay. And so afferent fibers are of two types, clamping fiber and mossy fiber. And efferent fiber is this actions of the. So this is the histology or internal structure. Outer grey matter or cortex, inner white matter fibers and neuroglia. Outer grey matter have three layers: molecular layer, Purkinje cell layer, granular layer. Molecular layer is the outermost layer. Cells are stellate cell, basket cells. Fibers are dendrites of the Purkinje cells, climbing fibers and parallel fibers. Okay, and Purkinje cell layer is middle layer, single row of flash shaped Purkinje cells. Granular layer is deep layer, cells are granule cells, Golgi cells, and fibers are mossy fibers, and glomeruli formation is there. Glomerulus is enlarged terminals of mossy fibers plus dendrites of granule cells and actions of the Golgi cells. Okay, they are together forming the glomerulus. See this cerebellar glomeruli. Okay, ends of the mossy fiber. These are the dendrites of the granule cell and action of the Golgi fiber. Okay, Golgi cell, action of the Golgi cell. They are together forming the glomeruli. So individual cell discussion, it will be covered in your histology. Okay, you can read from the books. So next we are going to afferent fibers of the cerebellum. Cerebellum receives input from mossy fibers and climbing fibers. Climbing fibers, these are olivocerebellar fibers. These are actions arising from inferior olivary nucleus, and they synapse in the molecular layer with the Purkinje cells. One fiber for one cell. And mossy fibers, these are other than olivocerebellar fibers. Rest of the fibers are called mossy fibers, and these include vestibulocerebellar, pontocerebellar, spinocerebellar fibers, and mossy fibers have dilated terminals in the granular cells. They synapse with dendrites of granule cells and actions of the Golgi cells, and this synapse forms a light staining cerebellar glomeruli. Okay. Next we go to the cerebellar nuclei embedded within the white matter. See, these are the cortex, outer grey matter, inner white matter you can see, and within the inner white matter, this grey matter portions, these are forming the cerebellar nucleus. Okay, this can remember DEGF. Okay, nucleus, dentate nucleus, which is a crumbled parts like appearance, nucleus dentatus or dentate nucleus. E is the nucleus emboliformis, G nucleus globosus, F is nucleus fastigius. Okay, so from lateral to medial, DEGF, you can remember like this. So there are four cerebellar nuclei on each side. These are masses of grey matter embedded deeply in the substance of white matter of the cerebellum. First one is dentate nucleus. কি করছে রে, ও ঘুমিয়ে গেছে ক্লাসে? This cerebellar nuclei, it has a shape like a crumpled parts. Its hilus faces medially. It is the nucleus of neocerebellum and highly evolved in the human. Next is emboliform nucleus. It is oval, lies lateral to the globose nucleus and medial to the dentate nucleus. Next is globose nucleus. It is round, lies between emboliform and fastigial nuclei. The emboliform and globose nuclei are the part of paleocerebellum and they are collectively called nucleus interpositus. Next is nucleus fastigius. It lies close to the midline in the vermis, just dorsal to the fourth ventricle. It is spherical. It is the nucleus of archicerebellum. Okay. This is schematic diagram. Cortex, medulla, medulla, white fibers. These are the cerebellar nuclei, dentata, nucleus dentatus, nucleus emboliformis, globosus, and fastigius. Okay. White matter of cerebellum forms the medulla of the cerebellum and it has typical tree-like branching appearance called arbor vitae cerebelli. White matter consists of intrinsic, afferent and efferent fibers. Intrinsic fibers, they do not leave the cerebellum and remain confined to the cerebellum. They connect the different regions of the cerebellum. Projection fibers, they are afferent and efferent fibers. They connect the cerebellum with other parts of the brain and they are arranged into three large bundles on each side as the superior, middle and inferior cerebellar peduncles. Okay, projection fibers. Cerebellum is concerned with maintenance of balance and equilibrium and modifies and refines all the body movements and makes them smooth and skilled. Hence, the cerebellum should be connected to these centers. Center which gives information about position of body parts, which gives information of motor activity and which can modify the motor activity. Okay, only then it can control the movements. Cerebellum is connected to various parts of brain and spinal cord by superior, middle and inferior cerebellar peduncles. These peduncles come in short note, mainly the inferior cerebellar peduncle. Okay, it can come as describe the cerebellar peduncles or only the inferior cerebellar peduncle, also known as restiform body. It can come as a short note. Restiform body can be given. You have to identify it is inferior cerebellar peduncle. Okay. So inferior cerebellar peduncle connects the cerebellum with medulla oblongata, also called restiform body, consists mainly of afferent fibers that carry sensory information. And afferent fibers are the posterior spinocerebellar fibers from ipsilateral thoracic nucleus, that is Clark's column of spinal cord. Vestibulocerebellar tract from vestibular nerve and nuclei. Olivocerebellar tract from opposite inferior olivary nucleus, they form the climbing fiber. Next is paraolivocerebellar tract from opposite medial olivary nuclei. Cuneo-cerebellar or posterior external arcuate fibers from the ipsilateral accessory cuneate nuclei. Reticulocerebellar fiber from reticular nuclei of medulla oblongata and anterior external arcuate fiber from both the arcuate nuclei. Next is efferent fibers are cerebello-reticular fibers from both the fastigial nuclei to reticular formation and cerebello-vestibular fiber from ipsilateral flocculonodular lobe and fastigial nuclei of both sides to the vestibular nuclei. And next is cerebello-olivary fibers. So these are the afferents. Mainly afferents are the more in number in the inferior cerebellar peduncle. Next is middle cerebellar peduncle. Here only afferents are present, no efferent. Okay, only efferent is pontocerebellar fiber from opposite pontine nuclei and reticulocerebellar fiber from pontine reticular nuclei. Next is the superior cerebellar peduncle. Superior one has afferent fiber and efferent fiber. Afferent is anterior spinocerebellar tract from spinal cord, tectocerebellar from the tectum, superior and inferior colliculus of the midbrain is known as tectum, and trigeminocerebellar fiber from superior sensory nucleus of trigeminal nerve, ruprocerebellar fiber from red nucleus, cerebellocerebellar fibers from locus coeruleus located in the pons. And efferent fibers are cerebello-rubral fibers from globose and emboliform nucleus to contralateral red nucleus. Next is dentatorubral and dentatothalamic fibers from dentate nucleus to opposite red nucleus and thalamus respectively, and cerebello-olivary fibers from dentate nucleus to contralateral olivary nucleus. Okay. So these are the three peduncles you can see: superior, middle, inferior. Green represents the afferents and red are the efferent. So middle has no efferent. Okay. Inferior has most are the afferents, some are the efferents. Okay, and it superior one also contains afferents and efferents. So this chart you remember: inferior cerebellar peduncle, middle cerebellar peduncle, superior cerebellar peduncle. These are the afferent and these are the efferents. We have already discussed it. So superior cerebellar peduncle consists of predominantly efferent fibers from the cerebellum, superior one. Middle cerebral peduncle contains afferent fibers from the pons, that is cortico-pontocerebellar tract. And inferior cerebellar peduncles contain mainly the afferent fibers from the brainstem and spinal cord. And the actions of the Purkinje cells are the main afferent fibers from the cerebellar nuclei, and mossy fibers are most of the afferent fibers to the cerebellum. For example, spinocerebellar, vestibulocerebellar, pontocerebellar fibers, all these are forming the mossy fibers. Cortico-pontocerebellar tract alerts the cerebellum about the initiation of movement, and olivocerebellar fibers from the inferior olivary nucleus form the climbing fiber that reach the cerebellar cortex, and these fibers play important role in performing learned new motor skills. Okay, and efferent fibers from the cerebellum mostly arise from the cerebellar nuclei. Climbing and mossy fibers are excitatory to the cerebellum. Cerebellum mostly receive information from the ipsilateral side of body and contralateral cerebral cortex. Next we go to arterial supply. It is supplied by three pairs of cerebellar arteries. Superior cerebellar artery is branch of basilar artery. Anterior inferior cerebellar artery also branch of basilar artery, and posterior inferior cerebellar artery branch of vertebral artery. Okay, so vertebrovascular system. Okay, and venous drainage: superior cerebellar veins drain into straight transverse and superior petrosal sinuses. They are lying in the posterior cranial fossa, and inferior cerebellar veins drain into the transverse and inferior petrosal sinuses. Okay, dural venous sinuses, all the drainage. Okay, next is cerebellar syndrome, very important clinical aspect. Okay, cerebellar syndrome is a group of signs and symptoms produced due to lesion of the cerebellum. And the components of cerebellar syndrome are divided into three sets: lesions of archicerebellum or flocculonodular lobe, that is vestibular cerebellum; lesions of paleocerebellum or spinal cerebellum; and lesions of neocerebellum or cerebral cerebellum. So what will be the symptoms due to lesions of flocculonodular lobe or archicerebellum? As the archicerebellum maintains equilibrium, tone and posture of the trunk muscles with the help of inputs from vestibular nuclei, its lesions lead to disequilibrium. Okay, characterized by unsteady and staggering gait. Patient tends to fall forward, backward, or laterally on standing, and it is called cerebellar ataxia. Okay. Next, there will be waddling gait. Patient stands and walks with the legs wide apart. Okay, it like this. He will walk. Okay, so with wide legs. Next, there will be nystagmus, the involuntary to and fro oscillatory movements of the eyeballs while looking to the either side. Okay, continuous rapid movements of the eyeball. Next, lesion in the paleocerebellum or spinal cerebellum. As the paleocerebellum maintains the tone, posture and crude movements of the limbs by sensory inputs from the spinal cord, its lesion leads to hypotonia, asthenia of limb muscles. It causes flail joints, lack of joint stability, Pendular knee jerk, tapping of patellar tendon produces oscillatory movement of the leg, and that is leg swings backward and forward. Another is cerebellar ataxia, and this is ataxia means disorderly in Greek, inability to maintain balance while walking. Okay. Next is lesion of neocerebellum or cerebral cerebellum. As the neocerebellum controls the smooth performance of skilled voluntary movement, its lesion produces these signs. First is asynergy. Asynergy means loss of smooth movements. Movements are intermittent and jerky. Dysmetria, errors in measurement of rates, range, force, and direction of movement. That means past pointing, finger nose test. Okay, inability to touch the nose by the finger. In the patient, they will not be able to touch the tip of nose. Okay, and if you hold it like this, and if you remove your force, it will hit himself. The patient will hit himself. She will not be able to control. Okay. So patient overshoots or undershoots the tip of the nose. This is past pointing. Intense and tremor. Tremors come on initiation of voluntary movement during holding something or during doing something like this, and disappear during the rest. And in some diseases there is continuous tremor, not only during doing something. Next is dysdiadochokinesia or adiadochokinesia, inability to perform respective alternating movements, and that is supination and pronation of forearm. এত লেট কোথায় ছিলিস? ও আচ্ছা আচ্ছা, ওকে। সো dysdiadochokinesia, this is supination pronation of forearm, tapping of one hand with other hand. Dysarthria or scanning speech, muscular incoordination produces slurred, prolonged explosive speech with pause in the wrong place. Okay, that's it. Dysarthria or scanning speech. Next is rebound phenomenon. Patient is unable to stop the action suddenly. For example, if patient pushes some object, on sudden removal of the object, patient is not able to stop the pushing act. Okay. So these terms you remember. This is important for cerebellar lesions. Okay, next is hypotonia, diminished muscle tone, result in excessive movement of the limbs, loose joints or ragdoll appearance. Lesions of the vermis and paravermal lesion, it results in truncal ataxia and nystagmus, abnormal stance and gait. Lesions of cerebellar hemispheres results in ataxia and tremor on the ipsilateral side of the body, and it also produces nystagmus, intention tremor, delayed initiation of motor activity, abnormal stance and gait, hypotonia, dysarthria, dysmetria, dysdiadochokinesia, dysrhythmia, and rebound phenomenon. Okay. So this is summarization. Lesions of archicerebellum affect trunk muscle, disequilibrium, staggering gait, cerebellar ataxia, waddling gait, nystagmus. Lesions of paliocerebellum affects the limb muscle. There will be flail joint, pendular knee jerk, cerebellar ataxia. Lesions of neocerebellum affects skilled movements. There will be asynergia, dysmetria. Dysmetria is finger nose test. Intense and tremor, dysdiadochokinesia, adiadochokinesia, dysarthria or scanning speech, rebound phenomenon, hypotonia. Okay. So we have discussed the cerebellum. Next we go to the fourth ventricle. Fourth ventricle individually can come as a short note, or floor of the fourth ventricle is very important. Comes in your theory. Very important theory question as short note or part of long question. And here also in viscera you can also be asked. Okay. So fourth ventricle is tent-like cavity of the hindbrain or rhombencephalon lying by ependyma and contains the CSF. Location is lies between the cerebellum behind and pons and upper part of medulla anteriorly. Continually, superiorly it continues with the cerebral aqueduct of the midbrain, and inferiorly continues with central canal of close part of medulla oblongata. Boundaries. It has lateral boundaries, roof, floor, four angles. Superior, it is diamond shaped space. So four angles, superior, inferior, two lateral angles. Roof is formed by the superior medullary velum, inferior medullary velum towards the cerebellum. So lateral boundary, it has the following boundaries on each side. Inferolateral boundary formed by gracile, cuneate, tubercle, inferior cerebellar peduncles. Superolateral boundary formed by the superior cerebellar peduncles. Roof or posterior wall is tent shaped or diamond shaped, has upper and lower parts and a apex. Apex of the roof is directed posteriorly. And upper sloping part of roof is formed by superior cerebellar peduncles, one on each side, and superior medullary velum in between the peduncles. And lower sloping part of roof formed by inferior medullary velum and ependyma of the ventricle and fold of pyometer. Okay. Next we go to the angles of fourth ventricle. Four angles are there. Superior angle, fourth ventricle continues with the cerebral aqueduct. Inferior angle, fourth ventricle continuous with central canal of medulla. And two lateral angles, one on each side, extends laterally as lateral recess of fourth ventricle. See, this is the fourth ventricle, tent shaped. Anterior to it lies the lower part of pons and upper part of medulla. And posterior to fourth ventricle lies the cerebellum. Okay, mainly the cerebellar vermis. Cerebellum mainly. And this is the choroid plexus of the fourth ventricle, helps in secretion of CSF. This is superior medullary velum forming the roof. Here is the inferior medullary velum forming the lower part of the roof. This part, pons and medulla forming the floor, and this is the angle, superior angle, inferior angle, and two lateral angle will be there. And this is the apex of the ventricle entering into the cerebellum. So location of fourth ventricle, cavity of hindbrain lies between the cerebellum behind, pons medulla anteriorly. Continuity superiorly with cerebral aqueduct, inferiorly central canal of medulla. Lateral boundaries, inferolateral gracile cuneate tubercle, inferior cerebellar peduncle. Superolateral, superior cerebellar peduncles. Roof is tent shaped, upper part superior medullary velum, inferior part inferior medullary velum, ependyma and fold of pia. Communication with third ventricle is cerebral aqueduct with central canal of medulla via foramen of Magendie and foramen of Lasca. Okay, two Lasca. Okay, and recesses, two lateral recess, two dorsolateral recess, one medial recess. Okay, only the recesses of fourth ventricle can come as a short note. This is can also come. See there, this blue lining is the showing the ependymal lining of the fourth ventricle. Okay, continuous above with cerebral aqueduct, below with the central canal of the medulla. And here is one cistern, cerebellomedullary cistern is present here. And you can see here, this is choroid plexuses. Here is the Magendie to foramen of Lasca. Okay, and roof has been shown here, superior medullary velum, and this is inferior medullary velum. Okay, so superior medullary velum is seat of white matter which extends between the two superior cerebellar peduncles here. Two superior cerebellar peduncles, they are connected via the superior medullary velum. And it is triangular, narrow above and wide below, continuous with vermis inferiorly. At frenulum veli, it is vertical ridge extending on the outer or posterior surface of superior medullary velum in the midline, and the trochlear nerve emerges on either side of this ridge. Next is inferior medullary velum is thin semilunar and it is white matter extending on each side of nodule or vermis of cerebellum. Its inner surface is covered by ependyma, outer surface by folds of pia. Laterally it is continuous with the white matter of the cerebellum. Next is tinea of the fourth ventricle. There are two narrow bands of white matter, one on each side. They are downward extension from inferior medullary velum and it completes the lower part of the floor of the roof of the fourth ventricle, tinea. Next we go to the floor. Floor is important, also known as rhomboid fossa. Today we have got restiform body. Restiform body is inferior cerebellar peduncle. Another term is rhomboid fossa. Rhomboid fossa is floor of the fourth ventricle. Okay, this comes in short note. So rhomboid fossa, the floor of fourth ventricle is diamond shaped, hence called rhomboid fossa, formed by posterior surface of pons and open part of medulla. Features: the floor of fourth ventricle shows these following features. First, there is median sulcus, divides the floor or rhomboid fossa into two equal halves. So there এটা হয়ে গেছে কি পড়ানো fourth ventricle হয়নি? Okay, so median sulcus divides the floor or rhomboid fossa into two equal halves. Next, lateral to this median sulcus. See here, the diagram টাকে দেখে নে. See, this is diamond shaped floor of the fourth ventricle. This midline one is the median sulcus. On the two sides, these two elevations are known as median eminence. Okay, median eminence near the middle or towards the lower side, two rounded structures you will see. These are facial colliculus. Here lies the abducent nerve nucleus, sixth nerve nucleus surrounded by internal genu of the facial nerve. And lateral to this median eminence, here is the sulcus limitans. Okay, at the upper end of sulcus limitans, superior fovea, and lower end will be the inferior fovea. Okay, and lateral to it, this area is known as vestibular area. And this stria, this is known as stria medullaris. And here in the lower part, some oblique line is dividing it into two triangles, hypoglossal triangle and vagal triangle. And this part, lowermost part, it looks like the nib of the pin. This part is known as obex, and here is known as tibia. This thin white matter structure is the tinea. Okay, and this part is known as funiculus separatus. So all these are parts of the floor of the fourth ventricle. So we will discuss it. So median sulcus, you have seen midline, median eminence, longitudinal elevation on either side of the median sulcus. Then there is sulcus limitans. It is shallow sulcus, limits the median eminence laterally. Next is superior fovea. It is small triangular depression at the upper end of sulcus limitans. And inferior fovea is small triangular depression at the inferior end of sulcus limitans. Next is facial colliculus. It is oval swelling on the upper part of median eminence at the level of superior fovea, and it is produced by looping fibers of seventh nerve around the abducent nucleus, internal genu of facial nerve. Locus ceruleus, it is bluish grey area in the upper part of superior fovea, and its color is due to melanin containing cells of substantia ferruginea. Okay, that's why it is important. It is bluish grey color is due to melanin containing cells of substantia ferruginea. Okay, next, in the lower part, sulcus limitans runs obliquely towards the median sulcus, divides the median eminence into two triangles, hypoglossal and vagal triangle. Seen in the picture, hypoglossal triangle is triangular area in the lower part of floor. Hypoglossal nucleus intercalatus lie deep to the hypoglossal triangle. Vagal triangle is dark triangular area on the median eminence that lies inferolateral to the hypoglossal triangle. And dorsal nucleus of vagus lie deep to this vagal triangle. Next is funiculus separatus. It is narrow ridge-like elevation of ependyma in the lower part of vagal triangle. Next is the area postrema. It is small tongue-shaped area between the funiculus separatus above and gracile tubercle below, and it contains the highly vascular neuroglial cells which act as chemoreceptor. It induces vomiting in response to the presence of emetic substances in the blood. Next is tinea. It is white, narrow ridge along the inferolateral margins of fourth ventricle. You have seen thin white matter. And obex is the meeting point of two tinea at the inferior ankle of fourth ventricle. So sulci and depressions are median sulcus, median eminence, Sulcus limitans, superior fovea, inferior fovea. And different important areas are facial colliculus, locus ceruleus, hypoglossal triangle, vagal triangle, funiculus separans, area postrema, tinea and obex. Okay. And clinical aspect is blockage of the fourth ventricle will lead to hydrocephalus. Medulloblastoma is tumor in this region, and there is in the medulla contains vital centers here. So in case of tumor in this region of fourth ventricle, there is high chance of compression of these vital centers. So this diagram you practice, and you practice for theory, floor of the fourth ventricle. This diagram, this schematic diagram, same things. See it properly. Median sulcus, these are sulcus limitans. In between the two, these are median eminence, these are facial colliculi. This is vestibular area. Here is the hypoglossal triangle, vagal triangle. Here is the funiculus separans, area postrema. This is ovex, and these are the tinea, and these are the stria medullaris. And this is the area of locus ceruleus near the superior fovea, and there is bluish grey discoloration. And this is superior cerebellar peduncle. Here will be the inferior cerebellar peduncle, and this is middle cerebellar peduncle, forming the all this you read in your book. Okay, floor is most important part. Recesses are important. Choroid, sometimes choroid plexus comes. Okay, choroid plexus, you have to write all. Choroid plexus of lateral ventricle, choroid plexus of third ventricle, choroid plexus of fourth ventricle, like this. And these are the clinical aspect. Hydrocephalus, you have seen during CSF circulation. Medulloblastoma is tumor in the fourth ventricle, and vital centrals are lying deep to the vagal triangle in the floor of fourth ventricle, and any injury to this area may be fatal due to injury to the vital centers. Okay, understood? Okay, so you come here and see the viscera. Specimen of cerebellum along with the brainstem. Okay, so these are the two cerebellar hemispheres, and in the midline this is the cerebellar vermis. Okay, this is superior surface and this is the inferior surface. You can see in the superior surface vermis is in line with the superior surface of the hemispheres, but in the inferior surface you can see prominent portion of the vermis and a deep depression. This is known as the vallecula. Okay, and see the different fissures and different parts of the brainstem. This part was part of the midbrain. Here is the pons and this is medulla oblongata. Okay, so in between the cerebellum and brainstem, here will be the location of the fourth ventricle. In this sagittal section, here you can see this is cerebellum and this is the brainstem, midbrain, pons and medulla. So this will be the location of the fourth ventricle. Okay, tent sepate. So this part is apex. This is floor of the fourth ventricle. These are the roof, superior medullary velum, inferior medullary velum, forming the roof. And see the connections. Here superiorly this is aqueduct of Sylvius connected to the third ventricle, and inferiorly it is connected to the central canal of the medulla oblongata. Okay, understood? So this is fourth ventricle, and see here in the cerebellum you can see this fissure, this one, and here this side. So this and this is fissura prima. Okay, fissura prima. Anterior to the fissura prima, this part is the anterior lobe of the cerebellum, and here you can see this is horizontal fissure, this fissure. Okay, this is horizontal fissure separating the superior surface from the inferior surface. Okay, and here if visible I will show you. See here, this is flocculus. Okay, flocculus, and corresponding part of the vermis will be the nodule. So this is flocculonodular lobe. This here, this one, and here this one, flocculus. Okay, and so this fissure is the posterolateral fissure. Okay, separating the flocculonodular lobe from the
posterior lobe. So 3 lobes are the anterior lobe, posterior lobe, flocculonodular lobe. Fissures are the fissura prima, here is the horizontal fissure, here is the posterolateral fissure, okay. And this part is the known as vermis. Different parts of vermis you read from theory, and this projecting part, this part is known as the tonsil, cerebellar tonsils, okay. And this depression is known as the vallecula, okay. Anteriorly there is V-shaped groove, posteriorly a deep sulcus, okay. V-shaped groove here is fourth ventricle, and here this is attached brainstem. If it is not attached, you can see the V-shaped groove, okay, understood. So this will be the anatomical position. Cerebellum will be lie posteriorly, brainstem will be anteriorly, and you superior vermis is in continuation with the two hemispheres. Inferiorly you will see deep groove, okay. So that's how you determine superior and inferior and place the cerebellar hemispheres posteriorly. Hold with your 2 hands, this will be the anatomical position of the cerebellum and the brainstem, okay, understood. This is choroid plexus of the fourth ventricle here, this one, okay. This is roof of the fourth ventricle, superior medullary velum, inferior medullary velum, and this is floor. Midline will be the median sulcus. On the 2 sides of midline, here this eminence you can see, this is median eminence, okay. On the side of median eminence will be the sulcus limitans. Not that much prominently seen. If proper specimen, if you cut it separately, then you can see the floor completely, okay. And this is section of vermis, and these are the cerebellar folium. See, multiple fissures are there, fine, is it? This is, we have discussed only 3 main important large fissures. Multiple fissures are there. Fissures are separating the cerebellar, those tree-like, each of the folium. Fissures are separating the folium, and this folium shows tree-like branching pattern. That is known as arborvitae, okay. This is not arborvitae, this is section of the vermis here. This also looks like a tree, but this is not arborvitae, okay. This is cerebellar vermis, okay. So you can determine those parts. This part will be lingula, then central lobule, culmen, declive, like this. Pyramid, uvula, tonsil will be, this part is tonsil, part of the hemispheres,